everyone, this is Holly Knudsen. I'm a holistic cancer coach and FDN from Utah, and today I want to talk about the different types of anemia and their causes. Anemia is defined as having a low oxygen carrying capacity in the blood, and this is caused by either not enough red blood cells or dysfunctional red blood cells. And these red blood cells are vital for delivering oxygen to tissues in the body. And there isn't just one type of anemia, but several, and each is linked to certain conditions, causes, and risk factors. And that's what I want to talk about in this video. The first type of anemia I want to talk about is iron-deficiency anemia. And this is a very common type of anemia, and it's caused by insufficient amounts of iron. Iron is necessary for the production of hemoglobin, which is a protein molecule in red blood cells. A deficiency of iron leads to low heme, an organic compound that iron atoms attach to. And this can lead to low levels of hemoglobin, which prevents oxygen from getting transported throughout the body. Iron supplementation is used to treat iron-deficiency anemia, which makes sense, right? Causes include an insufficient intake of iron in the diet or a reduced ability to absorb the iron in food that's eaten. A regular intake of iron-containing foods, including eggs, meat, seafood, dried fruit, leafy green vegetables, and iron-fortified foods can prevent iron-deficiency anemia. And supplementing with vitamin C at meals aids in the absorption of iron. Certain conditions such as celiac disease, Crohn's disease, and leaky gut, which a high percentage of the population has, are all risk factors for anemia because they can prevent iron from being absorbed. Blood loss can cause iron-deficiency anemia because iron is contained within blood. So the more blood that's lost, the more iron that's lost. I can personally attest to this because I had a hemorrhage following my third baby, and this left me extremely anemic for months afterwards, even though I had received blood transfusions. Heavy menstruation is another risk factor for anemia, as is prolonged chronic blood loss that can be caused by several conditions, ulcers in the stomach, hiatal hernias, polyps in the colon, and colon cancer. Pregnancy is a risk factor for low iron as well, and this is due to the increase in blood volume that takes place during pregnancy, along with the growing needs of a fetus. And this is why prenatal vitamins contain iron. People who frequently donate blood, menstruating women, infants who are born prematurely, and vegetarians are all at increased risk for developing iron-deficiency anemia. Mild forms of anemia generally don't cause complications. It can make you tired and dizzy. But severe forms can lead to growth problems in children, low birth weight babies, and cardiovascular problems. This is because the heart has to pump more and more blood due to the lack of oxygen contained within it. The second type of anemia I want to talk about is pernicious anemia. This is caused by a lack of red blood cells due to insufficient absorption of folate, which is B9, and vitamin B12. Impaired uptake of these nutrients prevents the production of healthy red blood cells, which are needed to carry oxygen throughout the body. People who can't properly absorb B vitamins or who lack the nutrients in their diet are at higher risk for developing pernicious anemia. The stomach lining produces a substance called intrinsic factor, and this factor is necessary to absorb B12. Pernicious anemia develops if the parietal cells within the stomach can't make intrinsic factor. Parietal cell destruction can be caused by an autoimmune attack in which the immune system attacks its own tissues, and in this case, it's the parietal cells. Pernicious anemia, if not diagnosed and treated, can cause permanent nerve and organ damage and is a risk factor for stomach cancer. Peripheral neuropathy or which is numbness and tingling in the hands and feet, weakness, exhaustion, confusion, and unsteady gait, and a bright red shiny tongue are all symptoms of pernicious anemia. If you're low in vitamin B12, it can mimic the symptoms of multiple sclerosis, and one of those symptoms is peripheral neuropathy. Diagnosis is made by taking a comprehensive medical history along with physical exams and diagnostic testing procedures. Blood testing is used to measure levels of B12, iron, and intrinsic factor in the blood. Antibodies against intrinsic factor can also be measured to confirm or rule out autoimmunity. Risk factors include being of Scandinavian or Northern European descent, having an existing autoimmune disease, a family history of pernicious anemia, being over 60 years of age, and having had portions of the intestines or stomach removed. And my great-grandfather, who was Danish, died of pernicious anemia when he was in his 40s. The disease used to be fatal. Fortunately, pernicious anemia is rare and can be successfully treated using B12 supplements or injections given on a regular basis. And this is because the B vitamins are water-soluble and they can't be stored. Serious long-term effects can occur if the condition is not appropriately treated, including gastric cancer, nerve damage, neurological problems, and damage to the heart. These effects can be permanent, and this underscores the importance of early diagnosis and treatment. The third type of anemia I want to talk about is aplastic anemia, and this is caused by a reduced number of red blood cells. Aplastic anemia, which is also called bone marrow failure, is not only a condition of low red blood cells, but also causes low levels of white blood cells and platelets. And this is the result of damage to the bone marrow where these cells are produced. Aplastic anemia is an autoimmune condition in which the immune system attacks the stem cells in the bone marrow. When stem cells are damaged, they can't produce cells. And that's why there are low levels of both red and white blood cells and platelets. And this production can either be halted or reduced, which causes low oxygen levels in the blood. Along with a reduced infection fighting capacity due to low white blood cells and impaired blood clotting caused by low platelets. Easy bruising, fevers, and frequent infections are common symptoms. And these symptoms can vary from person to person depending on the severity of the disease. This type of anemia is rare, with only 4 out of every 1,000,000 people developing it. It can be difficult to diagnose due to the similarity in symptoms to other diseases. The exact cause of the disease is unknown, but it can be triggered by numerous factors, including exposure to radiation, chemotherapy, specific viral infections, certain medications, ionizing radiation, benzene, and pesticides. Toxin exposure can stimulate an immune attack on the bone marrow. And that's pretty sobering because we are immersed in toxicity. Since radiation and chemotherapy can trigger aplastic anemia, people undergoing conventional cancer treatments are at increased risk for developing it, as are people who have diseased or damaged bone marrow. The condition can develop slowly over time and present with mild symptoms, or develop suddenly with more severe symptoms. Diagnostic tests include serum testing to measure blood cell counts in the blood. Bone marrow transplants, blood transfusions, and immune-suppressing medications are used to treat the disease. Necessary precautions are implemented to prevent infections if medications that suppress immune function are used. And lifestyle changes can help reduce exposure to toxins. Now, the last type of anemia I want to talk about is hemolytic anemia. Red blood cells live for approximately 120 days before being replaced via a process called hemolysis. Hemolytic anemia develops when red blood cells are destroyed faster than they can be replaced. There are two types of hemolytic anemia, acquired and inherited. Acquired hemolytic anemia can be triggered by certain medications, bacterial or viral infections, cancers of the blood, or autoimmune diseases. Inherited hemolytic anemia develops as a result of genetic factors that regulate red blood cells. It can be caused by sickle cell anemia or thalassemia. Both of these conditions are characterized by the production of red blood cells that have shorter lifespans than do normal red blood cells. Chronic lymphocytic leukemia and non-Hodgkin's lymphoma can trigger an autoimmune form of hemolytic anemia, and it's abbreviated AIHA. Tumors and overactive spleen, negative reactions to blood transfusions, and having a mechanical heart valve are all risk factors for developing hemolytic anemia. The condition can be either chronic or temporary. Common symptoms include jaundice, dark-colored urine, and enlarged spleen. Complete CBC blood counts and other testing methods that measure red blood cells, hemoglobin, antibodies, and hematocrit levels are used to diagnose the disease. Urine testing is also used to shed light on iron and hemoglobin levels. Biopsies and bone marrow aspirations are used to determine the amount, size, and maturity of blood cells. During a bone marrow aspiration, fluid is taken from the bone marrow, whereas during a biopsy, solid tissue is taken. Treatment depends on a variety of factors, such as the cause of the disease, the particular individual's reactions to specific medications and therapies, along with the overall health and medical history of the person. Treatment options include corticosteroid medications, surgery to remove the spleen, immunosuppressive therapy, immune globulin IVs, and blood transfusions. Here are some of the common symptoms of anemia, though each particular type of anemia has specific symptoms unique to that cause. These symptoms tend to be similar with all types of anemia due to a lack of oxygen. Shortness of breath, fatigue, tachycardia, which means a fast heart rate, dizziness, cold hands and feet, brittle nails, pale skin, headaches, lightheadedness, leg cramps, and increased thirst. In summary, there are several types of anemia, and there's even more than the ones that I talked about. Each is characterized by its own set of risk factors and causes. A low oxygen carrying capacity in the blood due to a lack of red blood cells can cause fatigue, weakness, and other symptoms. Iron-deficiency anemia is caused by low levels of iron. Pernicious anemia is an autoimmune condition related to B12 deficiency. Aplastic anemia occurs from damage to the bone marrow, and hemolytic anemia is the result of red blood cells being destroyed faster than they can be produced. And there is an autoimmune form of hemolytic anemia. Have you heard of these types of anemia, or did you just think there was iron deficiency anemia? Let me know in the comments, and thanks so much for watching.